Now, most of you know by now that even fully vaccinated, I had a breakthrough case of COVID not too long ago.
Yeah, COVID is all over the news with vaccine mandates and booster shots. So to fill us in on the very latest, we're turning to an expert, Dr. Douglas Tran from Edward-Elmhurst Health. Good morning, doctor. Good to have you.
Hey, good morning, Bob. Thanks for having me here.
Yeah, and doctor, let's get right to it because we know that there are vaccine mandates going on. Last week, President Biden issued a large one, and City of Chicago workers have been required to get a vaccine. Is the mandate the right solution, or is it educating people and letting them make their own decision?
Well, let me start by saying vaccines are working. They are safe, they're effective, they're keeping our infection rates low and disease related to COVID low. The unfortunate aspect is 30% of our country is not vaccinated. We probably need to get to about 90% to try to help stop this pandemic. Our leaders have tried to dangle the carrot in front of people. They've tried to nudge people to get vaccinated, and there's not much momentum for that. So mandates are here, and studies do show mandates do help out. They if it's done right, they will improve vaccinations at the hospital. For example, mandated influenza vaccinations for healthcare workers have increased 70% to 80% to 80 to 90% vaccinations, which translates to protection for the community. Of course, education, having the community understand their priority is important, as is partnering with the community and having a really good one-on-one empathetic discussion to build trust. All those are all important.
Doctor, I want to ask you about these booster shots. Who needs to rush out and get them?
Nobody needs to rush out and get a booster at this time, right? The Biden administration, U.S. Department of Health and Human Services, they stated that, later on in September here that they're thinking about giving a booster shot pending the FDA assessment and CDC guidance. At this point, we don't have guidance. The only group of people that have emergency use are immunocompromised patients. So once again, there's no reason to panic, go and rush out and get your third vaccine. The vaccines are effective and working.
Yeah, and just for clarification, for the people that do need to get the boosters, the immunocompromised, you cannot mix and match the boosters. Isn't that correct?
The science thus far suggests that mixing and matching is not appropriate, and let's not get ahead of the science here. So we'll follow what the experts and leaders are telling us in the field here.
Right. So if you got Pfizer, you got to get Pfizer. If you got Moderna, you got to get Moderna.
Once it's FDA approved.
Yes. All right.
Right. Moderna has given their information to the FDA for approval, and we're awaiting that that decision pretty soon here.
Okay, so doctor, what about kids in vaccine? My son Max is 13, almost 14. He has been vaccinated, but what about the ones under that age group? Where do they stand?
Well, listen, my son's turning 12 in a few weeks, and I have no reservations for him to get Pfizer's mRNA vaccine, and truthfully, he doesn't have any reservations as well. I speak to our pediatric colleagues at Edward-Elmhurst. They're telling me a quarter of the reported infections are now children. Children hospitalizations are increasing as we speak. We know that children's symptoms are less severe, but they assure me that no children is immune to getting severe symptoms. So adolescents 12 and older, FDA approved are at this time Pfizer's mRNA vaccination. The data and the data is still out for our children under 12, so we'll wait for the guidance on that.
Yeah, Dr. Tran, thank you so much. We appreciate all of the tireless work you and your colleagues are doing in the medical field right now.
No, I appreciate it. And I want to thank all the frontline workers as well. They're doing a great job throughout Chicagoland.
Yeah, and for more information, head to healthydrivenchicago.com.